Are we ready? You ready? Ready, Matt?
I'm ready.
Okay, good.
Yep.
Okay, so hi, everybody. Mary Jane Burke, the County Superintendent here. Happy to welcome you. As you've been through many of these for many of you, but just to make note that this is being recorded. Also, simultaneous translation is available in Spanish and will be available for anyone to view by tomorrow, in addition to any of the slide deck that Dr. Willis or Dr. Santora will be sharing. We did want you to be aware that the Marin Healthcare District has set up an opportunity, a virtual forum for Monday, April 25th. That will be specific to vaccinations for children 5 and up, also information about boosters that are available. So we'll make sure that we put that in the chat. We'll also have it on our website. And I think any opportunity to get more information for all of us is going to be ultimately helpful. And then also, just to make note, we think this is our last session of this type, given where we are related to COVID, but want to assure you that if at any point we think there needs to be another opportunity to provide information to our parents, to our school community, we will definitely step in. But for now, we think this might be the last one for this year. So, Michelle, can you go ahead and translate for our Spanish speakers?
Of course. Thank you so much. Hola, bienvenidos. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Muchas gracias a Marta B. Tone, que es nuestra intérprete esta tarde. Thank you so much.
Great. Thanks so much, Michelle. Okay, Dr. Willis, take it away.
Thanks. Thank you, Mary Jane.
Welcome.
Yeah, that's some of the best news. Is to think about this as potentially the last of these sorts of convenings. I think it's partly because we are reaching the end of the school year, but it's also because our relationship with this virus is changing and maturing. We're seeing less transmission, but we also, I think, have just a better understanding within the community of how to manage it within our own institutions and within our own schools. So I'm honored to have the chance to offer kind of a retrospective, start with a retrospective view over the past 2 years, just going through some of the key outcomes that we've seen as a community before we get into a description of kind of where we are now. And then Dr. Santora will talk about some of our future steps. So next slide, please. So we just want to look back. This is about 2 years ago where we first heard of this virus that was brewing in Wuhan province in China, trying to get a handle on what it might mean for us. Characteristic of our relationship with Marin County Office of Education, Mary Jane Burke reached out very early and said, "Hey, public health, how can we do this best together?" And we had a convening more than 2 years ago, and this, I think, is a screen. This is an image of that convening. We were in person together without face masks. How much we've learned since then. Next slide, please. This is just looking at our, again, just the retrospective over the past 2 years combined. This is our case rates in Marin County compared to other California counties. We wanted a chance to share with you, just stepping back, what the result of our collective work has been together. Obviously, it's challenging to define success in the context of a pandemic when at best we are limiting harm. And so we're doing that comparatively. So we're looking at Marin compared to other counties, the state, and the nation to have a sense of how we fared in relative terms. And this shows that our case rates in Marin, 12.7% of our residents since the start of the pandemic have been diagnosed with COVID-19. And that compares to over 20% at the state level. 1 in 5 residents of the state of California have been diagnosed with COVID-19. That's closer to 1 in 8 for Marin County. Next slide, please. This shows, even more importantly, shows the burden of more severe consequences, of more severe illnesses, hospitalization rates in Marin County. The blue line there shows our hospitalization rates as they rose and fell over the course of different waves of the pandemic. It shows that at every stage, we really were having lower hospitalization rates compared to the state and the nation. So far, as at the end here, we're looking at about 1/3 of the hospitalization rate in Marin compared to the state and the nation. Next slide, please. And then, as you might imagine, with lower case rates, lower hospitalization rates, we'll also see on the next slide, please, the reduced mortality, fewer deaths. We've had about 1/2 the deaths in Marin County as we're experienced on average for the same population size as the state of California, and about 1/3 of what was experienced nationally. So again, I think a real sign of the collective impact of all the actions that we took as a community to reduce the burden of this virus in our community and measurable in these outcomes. Next slide, please. And this is one of the most important reasons why we had those successes and outcomes, which is the corresponding highest rates of vaccinations. Almost at every month, as we look month by month, Marin County stood out as an outlier nationally in vaccination rates. And this is the summary so far, done, I think, on the 20th of March, looking across every county in the United States that has more than 100,000 residents, and more than 2,000 counties in that category. And Marin has the highest rates overall of people who are fully vaccinated and boosted. And what's also interesting about this data, I think, is that you can see there in the top 10 counties nationally, the 6 that came together way back in early March of 2020 to issue the first national shelter-in-place policy are in fact those 6 still in that 6 counties that have the highest rates of vaccination all the way along. So I think we're fortunate to be embedded within a region of strong public health practice and strong understanding of the science and the corresponding benefits for us in terms of a reduced burden of hospitalizations and deaths. And next slide, please. And that also for us in Marin has corresponded to getting children back, getting students back into classrooms. This group, more than anyone, knows how hard we have worked together to make that happen. It was a value right off the bat from the very start. We are among the first counties to close schools when we felt like we did not know enough to be secure that schools could be safe. As soon as we started to learn more about the transmission dynamics, we learned more about how we can open schools safely. We applied those lessons in that 32-point plan. We're one of the first counties to reopen schools recognized by the U.S. Department of Education for strong partnership between public health and school community. And in fact, in the 2020-21 school year, almost 3 million combined student days in school, one day being one student coming in that day, adding together, aggregated across the entire county, that 2021 school year when many jurisdictions and many schools did not open at all. We had over almost 3 million, 280,000 occurrences of well-being. If you think about one day where a child comes into school as being an event of well-being relative to the alternative of staying home and doing a distance learning approach, that's a lot of impact in that school year, thanks to all of your hard work. And then this year, it's over 5 million student days in school. Thank you. Next slide, please. And these are some of the factors contributing to our success. And I've already mentioned them. I think a lot of it really comes down to the community in which we live and are fortunate to have collective, our neighbors, our classmates, our friends, our families understand what it means to come together and be responsible for one another's well-being. We also have tools to prevent spread, which we optimized before the vaccine came along with the 32-point plan, social distancing, face covering, et cetera. And then after the vaccine came, that became really our most important strategy. A shared understanding of our mutual responsibility and the fact that these actions were positively reinforcing. So as we were able to adopt best practices, we saw how it paid off, and it just reinforced and strengthened more widespread adoption of those practices. From our standpoint in public health, we focused on a balanced response, recognizing health as a matter of social, emotional, physical, mental well-being, and not merely the absence of disease. And then a lot of communication, I think. And that's a strength that I think Mary Jane, Marin County Office of Education, and all of you in the school community really helped us communicate frequently and effectively. And then clear operations. All those, within values and communications, we also just need to be managing things well in terms of the operations. And I think that's another particular strength of you all and our school communities as a whole, is being able to actually execute plans effectively. Next slide, please. So those are some of the factors that contributed to our success. Where are we now? I think that's Stinson Beach. Next slide, please. We're not. I wish we were at Stinson Beach. So this is our case rates currently. We are, coming out of that remarkable surge in cases that happened in the wintertime with Omicron wave. We are now seeing, and just because of the size of that y-axis and what's that done to our case rates, it's really harder to perceive the reality that we are seeing a slight increase in cases now over the past couple of weeks. We're at about 25 cases per day on average in Marin. A couple of weeks ago, now it's like creep up to between 30 and 35 cases per day on average. We're also seeing a corresponding slight uptick in our wastewater. And that's expected. I think we need to make sure that we're not overreacting to this reality and preparing ourselves for the fact that we are going to see some ups and downs, ebbs and flows in this virus. And just feeling secure that we have the tools we need to prevent more widespread transmission, especially with high vaccination rates. But we are seeing more cases, and it's probably partly attributable to the BA.2 variant that I'll talk about in a second. Next slide, please. So what's happening with BA.2? BA.2 has been the dominant strain in the Bay Area now for over a month. And so it really has had a chance to declare itself in terms of its behavior. And I think we can all feel highly reassured that over that period of time where BA.2 is probably now close to 100%, we haven't really seen a major surge in cases. We have not seen a major surge in cases. We've not seen increases in people coming into the hospital. But it is more infectious, slightly more infectious than the other, the original Omicron variant. We're seeing increases in cases back east. And so it's not a surprise that we're seeing some signature of that in our community. We are seeing slight increases in cases. We're watching very carefully what's happening in the Northeast because their cases have increased dramatically, way more than our cases have increased, 60% increase, 55% increase in some of the Northeast states. But in those states where we're seeing those more dramatic increases, only modest increases in hospitalizations. And then actually no increase in death rates. In fact, death rates continue to decline in those regions. So that's an important sign to us that while we might see more cases, our hospitals should remain stable, but we'll be watching this carefully. Next slide, please. So in Marin, again, it's the dominant strain here without a surge. We're seeing a slight uptick. Our hospitals are stable. We're watching what's happening in the Northeast. And we think that now that if we do see an increase, and I'll talk about an example of this, in cases, it's more likely to be our behaviors leading to that in terms of spring break, travel, gathering differently. We haven't been covering our faces as much. And that's more likely to be causing any of the increases we're seeing more than the intrinsic properties of the variant itself. Next slide. So just wanted to end on this because this has been a matter of concern and interest over the past couple of days. As you know, for years, it's been a Marin County tradition that 8th grade students travel to Washington, D.C. as part of their education about history and civics. And that's been on hold for a couple of years with the pandemic, but many schools did participate in that field trip this past spring break week. We don't know exactly how many classrooms traveled back east. Some of them go as classrooms, some of them actually go through groups touring groups that convene 8th graders together. We did have testing on many return on Saturday and Sunday of this weekend. the testing that we saw from the 4th, the 11th to the 13th, so that's Monday through today, we had 50 within two groups primarily, within 112 children, 8th graders returning. Within those two groups, we have 50 positive results. So 50 out of 112 is about 45%. And then we call that the attack rate. So that's a relatively high attack rate. 45% of those within those two groups of those 8th graders that traveled to the East have tested positive. Fortunately, none. Next slide, please. I'll just summarize what our experience is with them. So on the 11th, we issued an advisory to trip participants, seeing that we were seeing elevated case rates among returnees. We thought we would just communicate to everyone who had participated in these trips to test on return, and then on day 5, and to notify schools of the results. Obviously, stay home if it's a positive result, to monitor for symptoms, and to stay home if they're having symptoms of COVID-19, even if they attribute it to allergies or a cold, because of that known exposure, regardless of test results, to stay home until symptoms are resolved, and then cover their face indoors in schools for 5 days after the return. We have not seen evidence yet for any in-school transmission related to this cluster of cases. Fortunately, those that we're aware of were testing on day 1 when they came back, and not coming into the school setting. Importantly, one of the reasons why this has not had a significant impact and has not been significantly disruptive to our schools, and why we haven't seen more severe illness, is that 90% of our 8th graders are fully vaccinated, and we're at some of the highest rates in the nation, and 50% are not only fully vaccinated but also boosted, and that is offering significant protection to these students who are exposed and infected. And then just stepping back, this is a reminder that safe travel means knowing the risks. So if someone is at higher risk for severe illness if they are infected, to take that into account in the travel plans. Vaccination is the most important thing to protect yourselves. Face covering while traveling, it's still required federally that people cover their faces on public transportation and mass transportation. And then testing on return and avoiding indoor crowds are all important elements of safe travel. We are not reacting to this outbreak by offering any specific new restrictions or recommendations to the people reconsider their travel plans, so much as reminding people of the elements of safe travel. And that concludes my presentation. Next slide, please. And now I'll turn over to Dr. Santora for looking forward, and then afterwards we can get into questions. Thank you.
So the picture of Stinson Beach, you were correct that it was Stinson Beach. It was a photo from earlier this week when spring break started. And I think that is a lower risk activity. It's an aerial view that shows people widely spread out and people outdoors. And as Dr. Willis mentioned, we have known knowns in COVID where travel increases risk because of just the nature of carpooling itself and being in airports, and then also traveling to places that may have higher prevalence of the BA.2 variant, all increased risk. But we're shifting towards balancing that risk with the benefits of that travel, of such a tremendous educational opportunity for students to see our nation's capital. Unfortunately, what happens in DC does not stay in DC, where COVID is related. It does travel with us. Looking forward to the spring. This is a flashback, and hopefully it will look like some photos that get published in the Marin IJ for this spring and into early summer. This is the Terralinda High School graduation from 2019, where you're seeing our students processing outdoors without masks. I would expect to see some students maybe wearing a mask outdoors because of exposure or personal, assuming some personal risk. They may have a medical condition that places them at higher risk for COVID-19 exposure, but we're hoping for 2022 to be a banner year for our graduation season. That being said, it is a known for us, and when the uptick that we're seeing with spring break return, we also would expect to see an uptick with pre-graduation and graduation parties. That's what we saw last year, and the past is replicated in the future. So it's really going to be human behaviors that drive the upticks in cases that we see. Graduation and the end of school parties is the first predictable pattern of gatherings, and that's followed again by the 4th of July. And just to be aware for everyone on this call that the levels of Omicron that we have in the community will not be extinguished by the end of the spring or the beginning of the summer. There's sufficient virus that's circulating in our community that will keep it in the background, and why staying vigilant, coming up to date when you become booster eligible, and practicing the behaviors that we'll talk about, or protective behaviors, are critical as we move into the spring. So you can jump to the next slide. So vaccine is our first tool. We are focusing on ensuring that we have racial equity and vaccine distribution in our community. We have set a new objectives for boosters among our Latinx and Black and African American populations to achieve that, reduce the racial disparities that we're seeing in vaccine or booster distribution in this case. And we'll be working with our community response teams across the county and increasing outreach and education to achieve these goals. You can jump to the next slide. We have, Dr. Willis mentioned the high rates of vaccination among our students, which we're very proud of. But when you look at racial and ethnic disparities, you'll see this is another place where we see differences. And so our teams will be working with the school communities as well as with our community response teams to increase the primary vaccine rates among our Latinx pediatric population, as well as our Black and African American population. And you'll see that it's a smaller amount of doses to receive to achieve these goals before the end of the school year. And we are partnering with our healthcare providers to move forward towards these goals. And jump ahead. So what is on the horizon for us as well is the vaccination for the 0 to 4-year-old population, or the under 5 population. We see this as continuing to be an important tool for public health in vaccinating all who will become eligible. This data, you can't really see it on the right-hand side of the screen. It's just showing the increase in hospitalizations for that population of 0 to 4-year-olds during that Omicron surge. So it is not, this age group is not affected as severely as past flu seasons have affected the 0 to 4 age group, or 6 months to 4-year-old age group. But Omicron still continues to infect children under the age of 5 in our own community. And some children are hospitalized because of the severity of even Omicron, which is known as a less virulent disease. With this population, the pediatric population, just like the adult population, when you have so much disease circulating, individuals who are at higher risk because of intrinsic factors, or they might have a genetic predisposition for having a respiratory disease, or requiring hospitalization. When we have so much disease circulating, that there's a higher number of individuals, including this population, who will become hospitalized. We've been fortunate in Marin County because of protective behaviors of our residents. We haven't seen an increase in this hospitalization in this age group. And one of those protective behaviors is cocooning, where all the adults and all the eligible persons around the 0 to 4-year-olds are vaccinated. And that's a critical tool while we wait for the arrival of this vaccine. So you can jump to the next slide. So we're still in waiting mode. We haven't heard anything from the FDA since March announcements. We are anticipating that Pfizer is going to be going back to the FDA and requesting approval for a 3-dose series. It's a lower dosage than what you see with the Moderna dosage. And Moderna will be submitting its EUA for approval by the FDA for both 6 months through their 6-year-olds with a 25 microgram 2-dose primary series. And then we're expecting that Moderna will begin distribution, once approved by the FDA, for the 6 to 12-year-olds of a 50 microgram dose, and again, a 2-dose series. And Moderna has announced that they're planning booster doses for all of those age groups. So in the United States, Moderna is not offered yet, but in Australia, the European Union, and Canada, Moderna is a vaccine that is provided. There is a delay in Moderna submitting the FDA approval as it studied the risk of myocarditis. That's the heart inflammation that's been associated with the higher dose of the pediatric vaccine. But that being said, the post-clinical trials that they've seen in Australia, EU, and Canada support the EUA application of Moderna. So parents will have more choice. We're anticipating that for the 0 to 4 age groups, many parents will choose the 2-dose Moderna because it is 2 doses. That being said, we're also expecting a significant portion of parents will choose Pfizer, even though it's a 3-dose series, because they may be more comfortable because their older children have received the Pfizer dose. So our team is already working hard on planning pediatric vaccine clinics with our healthcare providers. So when these doses are approved, that we're ready to launch in the community and make sure they're available for Marin County residents. And again, we are expecting to see the same racial and ethnic disparities that we saw with the 5 to 11-year-old age group. And so we're already working with our teams to increase outreach and education so we can attempt to mitigate those disparities with the launch of these vaccine clinics. And again, we're working in partnership with community health partners like Marin Community Clinics and Marin City Health and Wellness Center to ensure that we are reaching out to populations who are lower income and represent communities of color in Marin County to, again, make sure the education is provided in advance so they can make informed choices around vaccination. You can jump to the next slide. So this is from vaccines to the smarter plan. It's an apropos transition because the first letter stands for shots. Vaccines and boosters remain the mainstay for our tools in preventing increases in COVID transmission or surges, as well as preventing outbreaks in our school settings. And by decreasing transmission, and schools play a great role in decreasing community transmission, it decreases the level of COVID in our community when everyone's in school and school's in session. It's when school's out of session that we see cases increase. But shots are the S in smarter. Mask, Dr. Willis mentioned the role of mask after exposures. The requirements and the orders around masking have decreased, but that has not changed the science. There's tremendous data that continues to show there's benefits for wearing masks, especially after an exposure event. So those students who have returned from Washington, D.C. are expected to be wearing masks in schools and in indoor public settings for the next 5 days, at least for the next 5 days, until they test negative on day 5. The CDC and CDPH recommend masking after exposure for 10 days. We recognize 10 days can be a long time, and we prefer to see 100% adherence to mask wearing for that first 5 days when there's the highest risk of disease transmission, but recognizing that there's the recommendation is for 10 days after an exposure. Just staying aware and ready. We were prepared to see a return of spring break travelers with an increase or uptick in cases. And so we were prepared for that. And we're really proud of the school's readiness to respond. There was communication over the weekend to make sure our team was notified that there were known positive cases, and we were able to deliver a communication on Monday. So again, that's showing the effectiveness of our school public health partnership, is that we were notified on the weekend and a communication went out on Monday, and we're partnering with the schools just to make sure that testing recommendations are followed. Testing, as Dr. Willis, around exposure, testing remains an important tool for us. And fortunately, we have testing available. We'll continue to work to make sure we have access to affordable testing and equity in testing. So as we see the end of the emergency around this public health pandemic, we would expect to see lower resources in testing. That's not happening yet. We're going to continue to pull down as many free tests as we can. But again, we see our role shifting in the fall when free tests may not be as readily available, that public health will play a continued role in making sure we have equitable access to testing. And so that's the COVID side of the house. And I think this is just really critical to shift our focus back towards the education side of the house. And that's why we shortened from our 30-point plan to this 7-point plan or smarter plan, really refocusing on education and addressing the educational attainment gaps or achievement gaps that were in Marin County prior to the pandemic, and then refocusing on the mental health and well-being of our students. We know this has been an extremely stressful year for families, school staff, teachers, administrators, and students. And we've seen an uptick in substance use and mental health concerns across our county. And we want to refocus on building those relationships that support students, that they have a sense of belonging in our schools, and they have someone that they trust that they can talk to, and really hoping that we can start shifting in our recovery towards focusing on the mental health and well-being because as Dr. Willis presented at that first presentation back in 2020, we, in June 2020, I think is when we had our all school presentation, that we don't see health as just the absence of disease. It's also the social, emotional well-being of our entire community. So you can jump to the next slide. So just a masking update, when we issued our smarter plan, we were in substantial community levels, and there was a shift in our recommendation from strongly recommending that everyone wear a mask to encouraging those, to recommending that individuals consider wearing a mask, especially if they or someone in their household is immunocompromised, at high risk for severe illness, or not up to date with their COVID-19 vaccine. I have used my personal experience that my kids have caregivers who are at higher risk. My parents are both over the age of 70, and they are often babysitters for my elementary school children. And so my children continue to wear masks in schools just to decrease that risk. And we're also going on a trip, and so they don't want to be exposed to COVID before we get on our own travel. So I think this is where we're again just shifting in your individual decision around which risk you're going to assume and which protective behaviors you're going to engage in to decrease COVID transmission activity, not only for our community at large, but for your family and your friend groups or social bubbles, as we used to call them. And just reinforcing the critical tool of keeping kids home when they're sick. You should have test kits in your house for yourself, for your children, and always test. Don't assume that it was a windy day and that allergies are in play. So that sore throat or that scratchy voice or that raspiness is just because of allergies. Assume that because we have substantial levels of COVID-19 and it's post-spring break, assume it's COVID first, especially if you were engaged in a higher risk activity, and test yourself and stay home until your symptoms are improving. So this is our new framework for our masking recommendations. We'll be strongly recommending people wear masks at schools when transmission is high. We'll be watching closely over the next week or so with the return from spring break to see if we shift from substantial community levels. We've been at substantial levels since March 23rd in Marin County, and we will be following this. We haven't yet hit that kind of 90 cases per 100,000 over a week period yet, but we, as Dr. Willis mentioned earlier, we did shift from the 25 cases per day to the 40 to 50 cases per day over the past couple of days. If that trend holds, then we would be potentially returning to high transmission levels in our community, but we will be seeing what happens in the next couple of days. And then when we're in substantial and moderate levels, I mentioned we have the consider wearing a mask based on your risk profile. And I'm not sure if we're ever going to get to the low based on the amount of Omicron and BA2 that's circulating nationally. We can hope maybe we hit the low at the end of the summer before school starts, or maybe we hit low when school returns. But again, just reinforcing the role that masking plays in our community for decreasing the risk of transmission. Can you jump ahead? So what also happened over spring break is it's a big occurrence, but it was on spring break, so I don't think it made as much news or fanfare. The state updated its isolation and quarantine guidance, as well as the CDPH K through 12 school guidance that end quarantine requirements. Isolation requirements are still in place. So if you test positive for COVID-19, you need to stay at home for 5 days, test on day 5 or later, and you need to have a negative test to end your isolation. That being said, they're now defined, the state is now defining what are high risk exposures. Those are known to everyone, I think, on this call. It's those household exposures when you're performing unmasked activities with increased exertion or voice projection. So that's our singing, performing arts, and sports, or when you have prolonged face-to-face contact, being at crowded events or concerts, especially when they're indoors. In those cases, if you have a known exposure to COVID-19, the recommendation is that you're extra vigilant in recommended mitigation measures, which no longer includes quarantine, except for those who work in specific high-risk settings like our nursing homes. You can jump to the next slide. So Dr. Willis already reviewed with you what are those mitigation strategies when he described what were the public health recommendations for those who are returning after an exposure event in Washington, D.C. The number one thing is staying home if you're sick and getting tested. everyone should get tested 5 days after an exposure. And we recommended, because we knew wanting to get a base test, we recommended everyone test prior to return to school after if they're exposed during that event. That sometimes we'll have an extra layer of testing or an extra testing cadence just as out of an abundance of caution. Just notably here, we know that Omicron is circulating. If someone has had Omicron within the past 90 days, it wasn't expected for them to be tested, but if they need to monitor for symptoms and if they do develop symptoms, to get tested. We are seeing reinfection with BA2 in people who had the BA1 variant. Typically, we're seeing that outside of the 90-day period. We're seeing it closer to the 4-month period. But again, don't assume it's not COVID. If you're developing symptoms consistent with COVID, get tested. And I think we're seeing around the reinfection rate that's approaching 5% right now with Omicron. So again, that's something that's been increasing over the past couple of weeks, and we'll be closely monitoring that. So just to reaffirm that we are seeing reinfections. If you are having symptoms consistent with COVID and it's been beyond 90 days, which time has been flying, our first Omicron variants were tested positive in middle of December. So it's not surprising for us to see reinfection with this much more contagious variant that is evading, that has a history of evading the vaccine. And I think that's it for the slide. So you can jump ahead. So what do we do moving forward? It's back to the basics, just reinforcing the importance of vaccine and staying up to date with your vaccines, staying at home, avoiding poorly ventilated spaces and crowds if you want to avoid exposure. I think all of us know what an event looks like where there's a high risk of transmission, and sometimes you're going to take that risk, and it's a good risk to take because of the fun that you may have at that event. But know that just like with travel, that you're assuming a higher risk if you're indoors with a lot of people in a crowded environment where no one's wearing masks. And I just want to emphasize, just the doctor in me, there's been a tremendous amount of studies. Doctors are trained in this, and hand washing is probably the one behavior that we've seen decrease significantly over the past 2 years, but it's probably one of the most protective behaviors. So everyone should just recommit to washing their hands frequently, or at least restocking your cars with the hand gel and making sure you have hand gel around you if you're not going to wash your hands with soap and water, but soap and water is best, as long as you're doing it for the full birthday song rather than cutting it short in 3 seconds. And that's it. I think our last slide is just a gratitude slide to you. This is a shot from our own Marin headlands on Mount Tam. I think the person is probably looking out at the ocean. It's not my family photo, but just remembering when we're having a tough day, we have so many amazing natural resources in Marin County, and you're probably only couple hundred yards from anywhere in Marin County from an amazing trailhead where you can just climb and hike and escape some of our worries and reconnect with what is so rewarding is the nature that surrounds us. So thanks to you all. And then jump ahead to the next slide so we can see Basil, who still hugs his father. We surveyed Basil yesterday. My 11-year-old is telling me that he's preparing for teenagedom by no longer hugging me, but Basil is still hugging his parents. So thanks to Basil.
Oh, very sweet. Very sweet. Okay, you guys ready? Here we go. Will 5 to 11-year-olds be eligible for boosters after 5 months?
That's what we're waiting for FDA approval still. So I'm anticipating that we'll have news on the boosters for this group in May, as early as May.
There's a question that says, sorry, I arrived late. Has the trip situation come up? So I'm assuming that's the Washington, D.C. trip. Where should parents address concerns about this? Without knowing what the specific concern is, Amy, if you would forward that to Rapid Response, we'll make sure that we get you to the right space. The one thing that's important to note, this was not a school district event. This was a trip that was coordinated by a sort of a national agency. So just for you to know, that might be where we might send you. When will you move from masks highly recommended to masks are an option? Perhaps we've already done that, Lisa?
We did that. So when we moved to substantial levels, we shifted our language from strongly recommend masking for all to consider masking if you're at higher risk, or if you or someone in your household is at higher risk for an adverse outcome from COVID-19, or if you're unvaccinated or not up to date in your vaccines.
Okay.
There's a
happen.
nuance there that's worth acknowledging, which is, I think the state still has a strong recommendation. And, we recognized it in Marin, our case rates were lower. And felt like this was a step we could take. We have monitoring case rates very closely and haven't seen significant increase in transmission within schools after it's more normative now for kids not to be covering their faces in K through 12. The pre-K environment or preschool environment is still one where this is being hotly debated nationally, and it's not a question that has a simple answer, and you see that reflected in kind of a wide range of practices across the nation. Recently, New York reinstituted the requirement, which involved a lot of controversy. We are still now it's a recommendation and not a requirement in Marin for our preschool students to continue to cover their face, but that's really an active topic for us of review, and we may be changing our language in the coming weeks.
Okay. And the other condition that allowed us to relax our recommendation more quickly than the state was also our high vaccination rates among school-age children. We're almost double our completion of the primary vaccine series is almost double in Marin County what the state average is. So that high vaccination rate, along with substantial lower case rates, supported the decision to relax our recommendation and really formally shift towards choice. And again, I think I said on this call, I feel like I repeated myself a lot this week, but it really is critically important for us that our words and recommendations are valued. And so by relaxing, being responsive and relaxing our recommendations, we hope that the school community, when we strengthen our recommendations around masking, we would see the school community follow suit, because it's based on most likely it would occur when we're seeing surging conditions and rapidly increasing case rates. And we have demonstrated that masking is an effective tool in our school environments to reduce the risk of in-school transmission, especially when there's high community transmission levels.
Okay.
And it's worth just noting that the state level, these conversations about language around our policies, so interesting, because they'll perseverate over days of whether we should say strongly recommend or just recommend or consider. And I always wonder whether, in the public side, whether there's a huge difference between those things. But I think that's where we are. So it's like once it's no longer required, there is still a spectrum of risk that we want to see reflected in our language. And so we take that very seriously. So when we move from recommend or strongly recommend to consider facial covering in Marin County schools, we recognize that would mean that children would no longer be covering their faces in schools. And that's indeed what we saw.
Matt, if we ever hear the word order again, we'll know what that means.
Yeah, and that's a whole right. Yes,
yeah,
exactly.
That's not unclear to us when there was an order. There's a parent, parent who's recommending that it would be great if schools could have a mask mandate the week after each going on a long break. And I would respond by saying schools would be allowed to do that, right? If they decided that would be an option.
Yes, and I want to point out, we had some really successful schools that began managing outbreaks before the spring break, and they reinstituted the masking requirement at the school level. Right. And we're just very proud of their responsiveness. They were following the smarter plan. They reinstituted their masking requirement without even needing to consult with public health, because they were ready and prepared to do that. And so we fully support schools that opt to implement stricter mitigation strategies based on conditions that they may be aware of or higher risk events. So for example, there's a lot of events that happen that we're not aware of that might be higher risk events that's only known at the school level, different gatherings, especially indoor gatherings. And if schools opt to have some additional layers, either of testing or masking after those higher risk events, we're fully supportive of that.
The other thing that this parent raised was that her child is reporting that the students are in the classroom coughing. And so I think we would all know that coughing students equals a symptom, right? And they should be not at school. So that would be something that we would all want, not to have coughing, well, not just students, coughing adults as well, right? Because that's the high up there. Stay home if you're not feeling well. Any updates? I believe you were speaking of the Coleman community who put the masks on, right away. Are
Yes,
there any
Coleman
updates?
Elementary, San Rafael City School
Yeah,
District.
they did
Made us
great.
proud.
Right? Is there anything else to update about that outbreak?
I believe that outbreak was the chain of infection or transmission was interrupted. So what the school did by testing and communicating with parents, so parents were notified and on alert to monitor for symptoms, using testing, reinstituting the masking requirement. I think their masking requirement is in place through April 15th. They've interrupted and then there's a natural break with spring break. The transmission chain was broken. So great job.
Okay, do we know yet if vaccinations will be required for students for next year?
We do not know yet. The governor indicated there's not been an update yet on vaccine mandates or requirements for students. Any more that you've heard of, Matt?
Okay, there's a response from someone that says, now we're back to the Mill Valley trip, that Marin teachers made the decisions on the trip, not the organizer. And just to clarify, whoever was staffing that were not working as Marin teachers at the time. They may happen to be Marin teachers, but they were working for a different agency. So just to clarify that. What do you recommend for a parent of a child with a severe language disorder at the PK level? He's being required to wear a mask, but his language is highly impacted. Do doctor exemptions exist for special needs children? I'd like to recommend on that this family would request an IEP meeting, individualized education plan, and meet with the team to determine what is the right approach for many of our students, particularly at the preschool level. Even when masks were ordered, they were in a situation where we were continuing to help support them in wearing a mask, but there are in fact some children who are unable to wear a mask based on their learning challenges.
And just to go back, I think that's the national dialogue and local dialogue that's happening around masking at that developmental age. It's a very, it's a complex question with complex solutions. And I think we recognize, I think when you think holistically about health and social emotional development and learning, and language learning and language acquisition, we're keenly aware that this age group between 0 to 4 is such a critical time in the development. And so that's why we're closely following and engaged. And as Dr. Willis said, there may be forthcoming recommendations from the county. That being said, every time we have recommendations, there's facilities that may opt to be more strict as they're weighing the risk and balances, risk and benefits of disease mitigation strategies versus learning.
Okay.
Yeah, and this would be a much different conversation after they're approved for vaccine, right?
Yeah.
Right.
The reason this is such a dilemma is this is our one remaining unvaccinated cohort in terms of development.
Right. And just to clarify, if a student is not yet 3, they may not have an IEP, but they would have an IFSP. And so I would go to that document to try to support what's the best relationship with masks. Okay, I think we are there. So to Dr. Willis, Dr. Santora, thanks so much. I'm sure as we start the next school year and it's the fall and all of that, we're going to have to at least have one of these getting everybody started, right? In terms of just all the basics, just to remind everybody, it is our plan to continue to work with our public health and wellness liaisons on a variety of issues that we know affect the health of our children and staff. So we look forward to see what steps we're going to be taking. One of the ones we can count on, I think, coming up first is going to be Narcan training for our school. So we've got a lot of steps to take, but just for you to know, there's more to come with this great relationship. So Dr. Santora, Dr. Willis, thanks so much. Take good care. Bye.